One thing that we're working on, Peter, is the ability to predict what happened based on claims. If the algorithms predict that 6, 9, 12 months from now, I'm going to require total knee replacement surgery. Then knowing that and anticipating that, there's a number of things that providers and health plans can do together, really sort of make that journey more predictive and more proactive and ultimately more personalized.
Welcome to Technovation. I'm your host, Peter High. My guest today is Rajeev Ronanki. Raj is the Chief Executive Officer of Lyric, a 30-year-old artificial intelligence-based platform that aims to simplify health plan payment accuracy and integrity for providers and health plans alike. Raj has been in his role for a bit more than a year, and he's focused on honing the company's offering to drive significant savings for customers. He has a long history in healthcare as a partner and consultant in Deloitte's healthcare innovation practice for about a decade, and more recently as Senior Vice President of Elevance Health and President, Carillon Digital Platforms. I look forward to learning more about how Raj sees AI impacting healthcare, an industry that's often been a late adopter of digital innovation, among other topics that he's expert in. Raj, welcome to Technovation. It's great to speak with you today.
Thanks for having me, Peter. Good to see you.
Yeah, likewise. Really nice to see you. I thought we'd begin with your company, Raj. You're the Chief Executive Officer of Lyric, a role you've had for a bit more than a year now. And maybe you could talk a bit about some background into Lyric's business, if you would.
So Lyric has been around for nearly 30 years. And over the course of that time, it's had various corporate owners, Peter, in terms of McKesson at one point, Change Healthcare most recently. And then when Change Healthcare was acquired by Optum and United, Lyric was spun out of Change. And previously, it was known as Claims Extend. And, just around the time that I took over as CEO, we rebranded the company as Lyric. So that's sort of a brief history about our company. What it does is that it sits basically as the first line of defense on the health plan side to make sure that claims are adjudicated accurately. And of all the billions of permutations and combinations of codes and other possible ways in which our claims are described today in terms of the services that are provided to a patient, we make sure that all of those different sort of billions of permutations and combinations of rules are adequately implemented and that we're paying or health plans are paying for the services that are most appropriate. So the claim to fame that we have is that we probably have one of the highest ROIs of any software in our industry. And this year, we're on track to save about $20 billion collectively across the system.
And you came to this role with a great deal of healthcare experience in a variety of different settings, from Elevance Health to being a consulting leader at Deloitte in a healthcare innovation. What was it about this space that particularly attracted you, Raj?
Yeah, great question, Peter. And so over the last couple of stints, both at Deloitte as well as most recently at Elevance Carillon, the intent that I have always had is, how do we create more consumer-friendly solutions? How do we take the friction out of payer-provider collaboration? How do we create more trust between payers and providers? And then ultimately in the process, make the business of care better for consumers. So that's always been the goal, whether it was at Deloitte or Elevance Carillon. As I came across this opportunity at Lyric, the interesting thing that they do for the healthcare system is that they're right at that sort of intersection of where all the transactions are flowing, and make sure that the transactions are accurate. So I thought it was a incredibly interesting point that Lyric occupies in the healthcare real estate ecosystem, if you will. And so I thought we could leverage that by creating more innovative solutions that ultimately could be made available to providers as well, so that as they submit their transactions about the services that were provided to patients, that it has the benefit of verifying against the health plan's policies, rules, and compliance requirements, and make sure we get it right the first time and avoid this back and forth that happens, where care is delivered and oftentimes it takes up to a year or more to resolve the payment associated with that. So if we can make that far simpler and make it more like the way in which credit card transactions work today, I think we would all benefit from it. And ultimately, as consumers, imagine if as you're leaving a hospital or a doctor's office, you know exactly what you owe, what services were provided, and what payments are kind of eventually going to be attributed towards the patient, and have the ability to settle that before you even leave the doctor's office. That's really the opportunity that's in front of us for Lyric, and that's kind of what got me excited about it, and hence why I'm here.
And talk a little bit, you talked about the consequential savings that you already are driving through the solutions that you have. Can you get into the mechanisms of how that's done? As you talk about, the healthcare system itself is a spider web of complexity, as anyone would know
Yeah.
who has visited a doctor recently, and it involves different segments, the doctor, him or herself, the practice or broader system that they're a part of, the payers, the insurance programs, et cetera. Talk a bit about how you remove some of that friction, as you noted.
So my initial impression of this issue, Peter, was that there was essentially an arms race between providers and payers. With providers investing more and more heavily in revenue cycle and revenue integrity solutions, and then health plans counteracting that through payment integrity and payment accuracy solutions on their side, with increasingly more sophisticated tools on both ends. But if you actually unpack that a bit, what really is the core of the issue is that both sides have antiquated core, ERP platforms. So the electronic medical record systems on the provider side, which have grown up over the last 30, 40 years, and have really become billing mechanisms, but really not very accurate billing mechanisms. So there's a lot of translation that happens, from the care that's provided to how it's codified and structured in a way that health plans can understand it and pay for it. And then equally, complex and obtuse on the payer side, you have, frequently COBOL mainframe-based systems that are adjudicating claims, even the more contemporaneous systems that are non-mainframe and are more cloud native or cloud, at least cloud hosted. They also have severe limitations in which how data is codified, structured, and eventually processed. So the reality is that about 80% of the issues that arise between payers and providers have to do with technology limitations on both sides, and compounded by a lack of provider education, how to accurately codify claims. So if we, in that process, can make sure that transactions are accurately codified, and in most cases, perhaps even do the work directly in the electronic medical record, then we have the ability to streamline this whole transaction flow that happens that's literally of no value to the provider or to the payer, and creates this waste across the system. So if we simplify that, that's really kind of what we're after, which is eliminate the non-value add spend that's happening in healthcare and allow both sides to invest and focus on the things that matter, which is ultimately improving the care for patients and creating better health for everyone.
It's an exciting story you tell, Raj, one where technology was part of the problem. You mentioned the antiquated ERP, for instance, at one point, a tremendous innovation that has sort of worn out its usefulness, at least in this application, as you're noting it, now being solved with technology as well. And, somebody who's been immersed in technology for quite some time, it must be fascinating to see the evolution of digital innovation to the point where it can actually be the aid, the way, the method in which this is actually overcome.
Yeah, absolutely. In some ways, I think that for various reasons, healthcare has largely skipped the internet tech era, and the more recent innovations that have happened since. And maybe it's an opportunity to leapfrog the internet era and adopt the AI era more directly. Much like some countries kind of leapfrog from landline adoption to just doing directly to mobile. Perhaps healthcare can take a leaf out of that sort of evolution of tech and go directly to sort of an AI era that could ultimately address some of these issues, which of course comes with a host of other responsibilities, as you know. But nonetheless, it's an opportunity for us to get it right this time.
Very interesting. You allude to artificial intelligence as part of the solution, of course. Can you talk a bit about the way in which AI is used as part of this?
Yeah, I think generally across the system, Peter, I think it's being used today as predominantly to one automate administrative processes that are essentially non-clinically oriented administrative processes like claims processing, prior auths, and things of that nature. Second, I think it's being used for creating insights of this vast amount of data that healthcare creates. I think I've read a stat somewhere that consumer healthcare data kind of doubles every 73 to 80 days. So to keep pace with that type of exponential expansion in data is going to require various AI solutions, including large language models, to translate all that into meaningful insights. And then finally, to deliver, more personalized service to consumers. We're all used to it in retail and financial services and every other part of our life. But in healthcare, I think the service is still, sort of at a population level versus at the individual level. I think AI definitely has the ability to do that. And then Lyric specifically, we're more on the administrative end of things. And so our investments in AI have been to, even further increase the efficiency of our solutions by automating our ability to detect and automate the rules that ultimately govern payments and transactions.
And who's the typical customer? What role do they play in the organizations that are your clients?
We typically sell into health plans, although TPAs and providers are also sort of increasingly becoming relevant for us. But let's say our typical health plan, our customers tend to be executives that are concerned about cost of care trends and making sure that payment integrity is used as a lever towards that. So CFOs or heads of network and provider networks and cost of care management. And increasingly tech, stakeholders like the chief AI officers, the chief data officers of our health plan customers are interested in our AI techniques and analytics. So that typically is who we tend to interface with.
Interesting. And tell me a bit more about the structure of your organization. How large is the company? Whatever metrics you're able to share that would provide some indication of the scale.
So we serve over 100 health plan customers, and so that's nearly every consequential health plan, 9 of the top 10 health plans. You could guess the one health plan we don't serve. Roughly, claims data representing about 200 million lives, and a workforce that's just north of 500.
Excellent. And as you're a little bit more than a year in role, as I mentioned earlier, where do you see the organization going based on all that's happened in the past year, and certainly that coincides with some of the trends we've already been talking about relative to artificial intelligence, some of what you're seeing in terms of the power of LLMs. But beyond that, where do you see Lyric going in the foreseeable future?
Yeah. So if you were to zoom out, and when I zoom out, sort of let's call it a 5 to 7 year future for Lyric, would be that we're the enablers of trust and collaboration between payers and providers by literally embedding all of the payment accuracy and payment integrity logic directly into the electronic medical record at the point of care, the point of service, and enable ultimately payments to be made in real time and eliminate all this friction and ping ponging that happens between payers and providers and unfortunately consumers. So that's going to take a bunch of technology investments that we're making, and more importantly, it's going to require a lot of cultural and business model innovation that needs to happen both for providers and health plans, which in a good way, but all change in healthcare, as it takes time. And so what was it, at a minimum, I think this is a 5 to 7 year transformation journey where we can make that happen. And in the here and now, we've continued to invest more heavily in AI and make sure that our products are anticipating the evolving landscape of how care is being delivered, and through it all, make sure that the payments between providers and health plans happen in a timely and accurate fashion, and that we're providing the most simple and easy to use solutions in that regard. One thing that is perhaps a zoom in innovation that we're working on, Peter, is the ability to predict what happened based on claims. So for instance, if I go into a doc with a swollen knee, if the algorithms predict that 6, 9, 12 months from now, I'm going to require total knee replacement surgery. Then knowing that and anticipating that, there's a number of things that providers and health plans can do together to recommend alternative therapies, other preventative measures that could potentially address the situation. Or if surgery is inevitable, then make the administrative side of it easy. The patient is well informed about the options of where to get care. Really sort of make that journey more predictive and more proactive and ultimately more personalized. And that's something we're very excited about rolling out to the market.
You mentioned appropriately in a couple different places the fact that you're in an industry that is not known for being the early adopters of innovation. And you talked to even in your most recent response about the necessity for cultural and business model innovation among your clients. And as you noted, change takes time. Talk a bit about why you're optimistic the change will come when, as you noted earlier, it's not an industry that necessarily is known for it, and the extent to which perhaps there's this possibility of the leapfrogging, technologically speaking. Why is this the time for that to happen?
Yeah, I think there are a few factors that are perhaps economic and demographics of our population that make it sort of much more possible that this is going to happen. So, for example, the Medicare, which has been fueling the growth for the healthcare system, across the collective stakeholders, providers in life sciences, pharma, and health plans. The boomers that are aging into Medicare, that peak year was last year. So it's trailing off in the next 7 years or so until Gen X starts to age into Medicare. So the first time ever, there's a fixed set of populations that health plans have to compete and win on factors beyond just price and network, right? And I think now sort of the consumer experience is going to start, to be more and more relevant. So that's kind of one, factor. Second, the reimbursement, sort of policy landscape from, for Medicare and Medicaid is placing a lot of emphasis on the consumer experience. So the CAP scores in Medicare, for example, have a very high impact towards star ratings for health plans and for providers. So, there's obviously an interest in securing that reimbursement, and the better service you provide, the higher the quality of the reimbursement. So if you put all those factors in, how do health plans compete and win? And in a competitive landscape, you have to provide better service along with better price and more access to a broader network, and then compete on the government side of the business with better service. So if you look at all of that and go, okay, so how are you going to do all that? So either health plans have to spend billions of dollars on just reimagining the core transactional systems, which I think ultimately have to happen. But in the interim, you could wrap all of that with heavy investments in AI so that customer service could be much better, the ability to anticipate, predict the needs for patients would be better. And you could start to progressively chip away at this consumer experience issue while over time addressing the core transactional ecosystem of the country. And that's kind of why I feel like this is the time to do it. Not to say that we will, but I think this is as good an opportunity as any in our last couple of decades to make this happen.
I want to talk a little bit more about your background. It's a fascinating one. You were a CTO at CSC. You were a consulting leader, as I mentioned, at Deloitte in the healthcare innovation practice. As you've noted, senior vice president at Elevance Health and president of Carillon Digital Platforms for about 5 years as well. Talk a bit about your experience both in services and consulting, as well as being a digital leader in one of the largest healthcare companies in the US, how these experiences prepared you for becoming, for the first time now, a chief executive officer of an organization.
Good question. So my roots, as you noted, I've always been in technology. So I have a computer science degree, and I've always spent nearly 3 decades plus in just core technology and sort of being a technologist that's used tech to transform the business model and the industries in which I've served. As technology became more and more the lifeblood of every organization, there's hardly a company, regardless of its size, that's not leveraging tech, at its core. So then essentially industries started to converge where the technology of technology and the business of technology all started to become, one and the same thing. So fortunately, I've had the experiences to run technology P&Ls that kind of allowed me to say, how would we monetize the business of technology and also use that to make the core business itself better and make those two things one and the same thing, as opposed to sort of treating IT as an enabler and business as a business, but really sort of converge the two. So then that kind of led me to this current stint at Lyric to be privileged to serve as the CEO of this company, where all of that becomes the core of the business, which is the technology is our business. And then we're using that to then drive the broader transformation of the industry. But having been on the industry side and understanding the issues and how tech is used and how we need to plug into those business ecosystems and technology ecosystems gives me the, sort of a perspective that's somewhat unique to be able to play this role.
Excellent. So we've talked about a number of trends of consequence to your company and to the industry more generally speaking. Spent for good reason a lot of time around artificial intelligence and broader data trends. Are there others as you look to the future, Raj, that particularly excite you that you think will have a meaningful impact both in the industry but also for Lyric?
You mentioned two of them. I think data and AI, I think, are core to everything that we're doing, and I think for the most part, the industry is coalesced around the same thing. So everyone collectively is making investments here, which is I think is going to be good for all of us. The other things that are also happening, I think, is as I said, an increasing focus on the consumer experience. And for the first time ever, like really sort of taking a meaningful look at how do we fix that end to end. And I'm encouraged by a lot of innovative industry partnerships and coalitions that are starting to take shape across the provider and the life sciences and payer ecosystems to kind of put it all together to say, how do we solve for this problem? So really kind of interested in furthering that cause there. And then as we look to the future, I think with a lot of and while this is not new, a lot of health plans and provider systems are starting to move their core workloads, core applications, sort of their infrastructure to the cloud, which once completed, I think would benefit us all because now you have the ecosystems that are built around the hyperscalers that we can leverage to drive innovation more quickly than we would have otherwise. And then with quantum around the corner and all the innovations that are happening on the compute front, with us being able to run algorithms where the data is and be able to encrypt that, federate those learnings, and do so without compromising security and privacy. That's another kind of interesting innovation that I think is also going to be a good tailwind for our industry.
Raj, clearly you're somebody who remains current, as your last answer would note, on tech trends and evolutions of the business landscape, especially as it pertains to healthcare. Anything that you read, listen to, and/or watch that you particularly recommend as sources you rely on to remain current?
Well, Peter Diamandis and his Abundance 360 sort of notes are always pithy, 10, 15-minute reads to stay current. But literally, Peter, no shortage of knowledge sources, including your own work and your podcast. So thank you for all that you do as well.
Well, you're kind to say that. Well, Raj, thank you so much for a great conversation, and we'll look forward to continuing to see the great work that you and your team at Lyric are doing in the months and years ahead. It's been a great conversation.
Thanks, Peter. Yeah, I really enjoyed it, and thanks for having me.